Dr. Stephanie Judkins is a optometrist who's specializing in low vision and low vision technology. Dr. Judkins is an optometrist who has a practice and has traveled with student volunteers in optometric service to humanity, to Jamaica, Belize, to perform eye exams, and to help those that need it the most. I would like to now present to you some of the sage advice and help from Dr. Stephanie Judkins. Get your appointment. Get that turned on.
Good morning. So again, my name is Dr. Stephanie Judkins, and first I would just like to say thank you to the Macular Degeneration Awareness Foundation for allowing me to be here this morning and talk to you all about low vision exams and low vision devices. I do practice in Campbell. I'm from Tennessee, so I'll try to keep my southern accent to a minimum this morning, but I apologize when I start talking fast, it may come out, so sorry about that. I'm in a 6-doctor group practice in Campbell. We're all optometrists, and some of the devices that we have in the back, we don't actually carry in our office on a full-time basis, but if you're interested in trying some of those devices, we can certainly have them in the office for you and let you experiment with some of those and find the devices that are right for you. First, I just want to kind of tell you all that I have a handout that's going to go with the lecture, and it's got some resources in the very back of it. So if you haven't got that, Marta, my assistant, is in the back, and she can, if you want to raise your hand, she can drop off any packets to anybody that missed out on those, or we'll have them at the end. I want to let you know how I got interested in eyesight and vision in the first place. So my story is that my mother, at a very young age of 26, had a choroidal neovascular membrane leak, which is one of those rare forms of wet macular degeneration that's not age-related. And so she was 26 when her leak first happened, and I was 6 years old. And I remember her losing her eyesight very suddenly and telling me, you know, if I close my eyes and look at your eye, I can't see the side of your face. And you know, I was a kid, and it was very scary. I thought my mom was going to go blind. So I remember hearing her stories about having the fluorescein injections and having to go to the retinal specialist, and at that time the injections weren't available. She had laser surgery, and thank goodness the surgeon did a remarkable job and has saved a lot of her vision, but she's still living with that today, and that plays a big role in why I'm in this industry. So what are we going to talk about today? I just really want to talk about what is low vision. We're talking a lot about macular degeneration, but low vision can be the result of macular degeneration. And what can we do about it? I think that one of the big things is you don't know what you don't know. And there's a lot of resources out there that can help you if you've lost some eyesight, and we want to talk about those today. All right, so low vision is when, even with regular glasses, contact lenses, medications, or surgery, everyday tasks are still hard. Your vision isn't perfectly correctable. There are more than 135 million people in the United States that are living with low vision. So as Ms. June pointed out, you are not alone, and there's so many great resources that can help you through this. So we'll get talking about some of those. So we just want to classify low vision so you kind of have an idea of what that really means. We all know that 20/20 is perfect vision. So, and just to kind of let you know, that 20 number on the top is kind of a standard number, and the larger the number on the bottom goes, the worse the vision is. So 20/30 to 20/60, that's just mild vision loss, near normal. 20/70 to 21/60 is moderate low vision. 20/200 to 20/400, that's severe vision impairment. And just to kind of give you an idea, the big E that we always talk about on our eye charts, that's 20/400. And we actually can measure beyond that. Don't feel like if I can't even see the big E, I'm hopeless. We have lots of ways to go beyond that. And again, profound low vision loss goes to 21,000. And then beyond that, you're getting near no light perception, blackout, blindness, which most of the time with macular degeneration, that does not happen at all. Legal blindness you'll hear people talking, oh, I'm legally blind, and I hear a lot of my younger patients say, I'm legally blind without my glasses. That's not true. If you can wear glasses to correct your vision, then you're not legally blind. But the definition of legal blindness is that your better seeing eye is 2200 or less. There's also legal blindness if you have a constricted visual field, which also doesn't usually happen with macular degeneration. You have more central vision problems, but with some other eye diseases like glaucoma and other things, it can constrict your peripheral vision, and so that also can be a definition of legal blindness. So again, there are many types of low vision, loss of central vision, which is what macular degeneration is really going to do. Loss of side vision, most of the time with glaucoma, some other eye diseases can do that. You can have just overall blurred vision or general haze, extreme light sensitivity, night blindness. So here's an example of loss of central vision. A lot of you may be living with things like this all the time. So you can see around the edges, but the central part is not there. This is a loss of side vision, so it's the exact opposite. You can see that face, but not much else around there. And then blurred vision or generalized haze, a cataract patient may experience something like this, where everything's just overall blurry. And then the light sensitivity, glare, night blindness, a lot of black light bouncing off of headlights and things like that. All right, so now we know what low vision is. What are we going to do about it? So there are low vision specialists that can actually help you maximize the vision that you do have with a lot of these devices that we're going to talk about. A low vision exam and a low vision specialist is different from Dr. Narayan, what he's doing in his exams. This is not necessarily a health examination. So again, what we're going to do is evaluate whether your vision that you have is able to be enhanced to help you do the things that you want to do. And this is not a one-stop shop or one visit fixes everything and then you're finished. It can be a series of visits. The first one can determine kind of the course of action that you and your doctor want to take. One of the big things is that you want to have reasonable expectations. We can't give you back that sight that is lost with dry or with wet macular degeneration. And it's not an eye health examination. So one of the big things that I want you to know is that we're going to do a lot of talking, especially in that first visit. I'm going to want to know exactly the things that you want to be doing. So if I asked you, what are some of the things that you're scared that you're not going to be able to do? What would you say? Anybody? Driving, computer? We'll talk a little bit more about some of those things. But one of the things that we're going to do, we all kind of know what this big thing is. You go to your eye doctor, you get behind that. That's called a phoropter. As my mom has taught me in my career as being an eye doctor, when you have central vision loss, it's very difficult to get behind here and make much use of what's going on in the eye chart. It's hard for me to get behind there, and my vision is perfectly correctable with my contact lenses. So in a low vision exam, we're going to pull you out from behind the phoropter, and we're going to use some other tools to kind of maximize your vision in real space. So you can see we'll do what we call a trial frame refraction, not put you behind the phoropter, and put some lenses up in front of you so we can see exactly how well we can correct the vision. Because we want to give you the best vision that we can with eyeglasses before we start using any kind of devices. So again, some of those goals that patients will tell us that they have, they don't want to stop driving, they don't want to stop reading, they want to be able to manage their finances. It's all about maintaining your independence, right? Maintain your good grooming habits. As ladies, we want to be able to put our makeup on still and look nice. Continue cooking, reading recipes, crafts, games. I know if I asked my grandmother, what would you not want to stop doing, she would tell me Facebook. She loves to get on Facebook and look at pictures of her grandkids and her great-grandkids, and so those kind of things are really important to her. And these are the things that you need to communicate with your low vision doctor, because the more information you give us about your specific goals, if you want to be able to sew, you have a certain needle that you want to thread, if you have medication bottles that you want to look at, bring those into us, because then we can really tailor your devices to be able to see those things that you need to look at every day. TV is another one. Computer, as we talked about. Okay, so let's kind of get into some low vision devices. Lighting, it's a simple thing, huge. There's near devices, intermediate devices, distance devices, and then there's something called eccentric viewing. I'm not going to talk too much about eccentric viewing today, but I'll touch on that right now. So as we've talked a lot this morning, when you lose central vision, you have these blind spots in your macula, as Dr. Narayan was talking about, doing the mapping, the perimetry test to see what actually is functioning. When you have eccentric viewing, you can actually train your eye to look around your blind spots and use the parts of your retina that may normally be used for more peripheral vision, but you can train your eyes to use those to see more central things by not looking exactly at what you're trying to see, but looking away. And a low vision specialist can give you some exercises and do a lot of training with you to help you maximize that. That's about all I'm going to say about that today, because we're going to talk about some of the toys that we have. So first of all, lighting. It's the simplest thing you can do. It's huge. It needs to be task specific. You want to be able to adjust that fixture on exactly what you're working at. So many times I have patients come in with their son or daughter, and I ask them, what kind of light is your mom using to read? Oh, we just turn on the overhead light. That's not good enough for a macular degeneration patient. You have to have some kind of lamp that you can point down on what you're looking at. It makes a world of difference. And the farther away that light source is from your target, the more stronger of a light that you need. So actually, you need 4 times stronger light to move it just 2 feet away. So make sure you're doing that. Positional lighting. If you have one eye, as Miss June was talking about, one eye is wet degeneration and one eye is dry. So she has one eye that sees better than the other. Put that light on the side of your body that's got the better seeing eye. And you want to make sure you position it where you're not getting a lot of glare. So you just really need to play with those things instead of just flipping on the overhead light and thinking that's as good as it's going to get. Typoscope is something else that you can use with the lighting. It kind of helps with glare. I'll show you a picture of that. Here is just an example of a good task-specific light right on that book that she's trying to read. And this is a typoscope. You can see that it's black here, so it's not going to have light bouncing off of it, so it's really going to help with glare. But then it's got this opening here so that you can really keep your place when you're reading. So that's really helpful. So we're going to talk about some near devices, and I've talked with a lot of you back here at the table. You've played with some of the magnifiers that we have back here, and talked with some of you about some of the things that you're using at home. So number one, have some of these things up here with me. Just a simple pair of strong reading glasses sometimes is all that you need. We do something called a prism half-eye, and so that's a stronger reading glass than you can buy over the counter. It's quite strong, but it's got what we call prism in it to actually help your eyes focus a little bit better along with that strong magnification. Spectacle mounted magnifiers. So those are going to be magnifiers that you actually put on top of your glasses. A hand-held or stand magnifier. That's one of these guys. You guys probably all are using something like that. And then we've got the video devices. And so we've got the ladies in the back that have some of those, and I have one of those at my table as well. So here's just some examples of those things. This is the spectacle mounted one. Here's a stand, and then here's some of those lovely video devices that are really, really nice. Now for intermediate, that's your computer. Sometimes if you're sewing, you're going to hold things down a little bit lower. A lot of your distance or your near devices can be tailored to serve a dual function and get you that intermediate vision as well. But computer screens on their own can be a great tool. Probably most of you know how to make the font really large on your computer. I know that the Macular Degeneration's website has a lovely little tool on there where you can click the button and make the font larger. So that's really helpful. But you can actually go into the settings on your computer and change things where for every website you go to, you can flip it where it's in reverse contrast like I have on my presentation, the white on black instead of black on white. And you can make it where it shows up in a standard font instead of all those lovely pretty little fonts that our web designers will give us to make it a little bit easier for you. So here's just some examples of changing the font. And keyboards here as well. You can have a large keyboard that can be lighted. A lot of times the black on yellow for macular degeneration patients is a little easier to see, so that's available for you. And now there's an app for that. There are so many apps for low vision, and actually I have one on my iPhone that I can show you, but it was $5.99, and it does close to some of the same things that these video devices can do for us. The flashlight app on your iPhone, just turning that on in a restaurant and shining light, again back to that lighting directly on what you're looking at, that can be huge. There's an app for money that actually you can hold your money under your iPhone and it will verbally tell you that's a 20, that's a 50. That's huge. I mean, because you need to know how much money you have, right? So in the handout that I've given you, there's a list of low vision apps that are now available. I'm sure a lot of you are using iPads and iPhones, and if you're not, I know you have kids that are and can help you get started with those, and they're very, very easy to use and very economical. So now getting into the distance devices, I was talking to one gentleman out here that's using a bioptic telescope for driving. A lot of times these can be handheld or mounted onto eyeglasses, so actual telescopic devices to magnify for distance. And then again, the video magnifiers, you can take those out in space with you and look at things when you're out traveling. So why do we need to magnify things in the distance? I just kind of want to point this out, why magnification is so huge. Here, this lady is really far away, and this blind spot is blocking out her entire face. And this is the exact same size blind spot here. But because we've magnified, we're now appreciating so much more of the details of her face, and you could probably recognize who she is. So that's what a lot of these distance magnifying devices can do for you. Here's just an example of a bioptic telescope for driving. In the state of California, you can continue to drive with a bioptic telescope. It does take some training, but very, very possible to maintain your independence and continue driving, even with reduced vision. And then here's an example of Ruby, which we have in the back for you to play with if you haven't seen it already. That's a video handheld magnifier to make all those things larger. And then there's so many household items that we can talk about just to make your daily life easier. Large button remote control. This little guy here, this is a liquid indicator. So you pour liquid in your teacup here, and when it gets full, it's going to make a sound for you. So you're not risking overflowing your cup and making a big mess. This is another typoscope, but this one goes with a checkbook. So you actually just lay it on top of your checks and you know exactly where all your fields go. So you're not trying to find those tiny little lines. So you can make your checks out and maintain your finances. This is a talking pill bottle. So you can actually voice record what your medications are, what the dosage is, and press the button. And it's going to tell you verbally what that is so you can hear it and not have to worry about reading those horrible, I think the pharmacy industry is trying to make us all think we're losing our vision with those tiny writings on the pill bottles. But that's very helpful. And then this is called a pen friend. And this is really cool. It comes with a pen here that's voice recordable and these little stickers. So what you do is you actually place the stickers on whatever you want. Canned goods is a huge one. And record what it is. And then you just go through your cabinet and touch your pen onto the sticker and it will say peas, tomatoes, so that you know exactly what you're opening and you don't put the wrong ingredient in your recipe. All right, so resources. Again, I want to reiterate today, you don't know what you don't know. And there are so many things that can help you and people that can help you and groups that can help you. And in the back of the handout that I've given you, there's a list of resources, local resources for low vision that you can try. I'm certainly happy to help you. Again, I'm here in Campbell. Just, again, looking at apps, lighting, those two things are in your resource handout, and some of the computer tips that we've talked about as well. So, in conclusion, make sure you visit a low vision specialist. Dr. Narayan is going to do a great job with your eye health. Sometimes when you have macular degeneration, you actually need two eye doctors. Someone that's taking care of treating the wet, giving you the injections, and then a low vision specialist that's helping you walk through your daily activities, maximizing that vision that you do have. So just make sure you take advantage of a low vision specialist. Communicate. We can't help you if we don't know what you want to do. So tell us every little thing that you're going to want to get done. Again, having realistic expectations and understanding that we can't give you back the sight that you've lost, but we can pretty much help you get through your day with a lot of these handy devices that we have. and you can maintain your independence. I mean, there's a lot of fear with macular degeneration that you'll lose your sight and you have to stay at home and you won't be able to do anything. And I think June is a great example. She really embodies exactly the way that you can continue to live your life when you've had vision loss. And so just don't lose hope. There's a lot of help out there for you. And I want to thank you. Okay, does anybody have any questions? I kind of sped through that. I know it's getting a hot.
Any questions?
Here, what's this? Any questions?
I want to know macular degeneration, is it age related or it can affect the younger population?
Well, there are several different types of macular degeneration. In the truest sense, we think of macular degeneration that we're talking about today as being age-related, but as Dr. Narayan mentioned, and as I was talking about with my mom, there are some other types of things that can happen to the macula that are degenerations of the macula, but that aren't necessarily age-related macular degeneration.
All right, thank you, Dr. Judkins.